I'm Jeffrey Griffin on a Medical Monday with our buddy John Dunn from Health Team Advantage. Is there a downtime, a quiet moment at Health Team Advantage?
This year has been extraordinarily busy.
I bet.
Lots of changes, especially on the pharmaceutical, the prescription drug side. So no downtime. We're here to serve.
The rules that are in place, can those change this year by executive order from the White House, or is what's in place already going to remain in place for 2025?
No, what's in place has to remain there. No executive order will change anything with Medicare.
Okay.
All of that has to go through the congressional process.
All right.
So yeah, everything is status quo as is, no surprise change. What is the difference between a healthcare concierge at Health Team Advantage and customer service at any other? When you join Health Team Advantage, you are assigned your own personal healthcare concierge. So you know, this is my go-to person to help me navigate this complicated healthcare system that we have.
Because when it comes to healthcare concerns and moving forward, we want immediate answers.
Absolutely.
And access to all those resources. And that's part of the joy of collaborating with Health Team Advantage. When my mom was doing the whole Medicare thing, there was a lady that would call her once a month, not to sell anything,
right? Just
to check up on you.
Yeah.
How you doing? Is there anything that you need? How can I help you?
And it makes you more comfortable as the member to be more open, because the more open you are with your health and what's going on, the more we're able to help you. Because at the time you're being signed up for the plan, there's no way your agent has time to go through every single detail.
Sure.
So that healthcare concierge can be a great asset if you just use them.
Well, why don't we get you a gym membership? You can go walk, and don't walk by yourself. Walk with some others. There's all kinds of opportunities.
That's right.
To take care of you.
And, a great thing we have here in the Triad, and it's promoted strongly, is our senior games. That will be starting up very soon.
Right.
If you have any questions about that, you can always go to Health Team Advantage's Facebook page. We post everything there, all of the events where we'll be. So, I mean, that's a great resource. You don't have to be an athlete to participate in these events.
Right.
All skill levels are welcome.
You know, friends, you can also visit the Health Team Advantage website. It's easy to navigate. It's intuitive. It's large print. It is simplified language.
We have put a lot of time into the design of the website to make it easy to navigate.
And John, it's a local company.
Yes, Jeffrey. Born and bred right here in the Triad.
So, yeah, these are the doctors and the nurses and all the support personnel that you know and have worked with for generations. The folks at Health Team Advantage, they're there 8 to 8, right? Be there till 8 tonight? Okay.
12 hours a day, 7 days a week.
Hey, they are when you need them. If you're more comfortable with a sit-down face-to-face, here's all my stuff, we can take care of that too.
That's exactly right. We'd love to see you face-to-face.
And where is that?
Right across from the Palladium Theaters, 5815 Samet Drive.
9 to 4, Monday through Friday. Medicare. In general, it's automatic at 65. I don't have to do a thing. It's just going to show up when I need it.
Well, partially correct. Yes.
All right.
Medicare has several different parts. Part A, you will get automatically as long as you or your spouse has worked 10 years or 40 quarters throughout your lifetime.
Okay.
So at age 65, you will automatically be eligible for Part A.
And the Part A is when you're in the hospital.
That's right. That is your hospital coverage. Now, original Medicare Part A, there's a huge deductible, a 20% coinsurance that goes on for eternity. No stop loss there.
But it is a first step.
It is.
So,
absolutely.
Before you can get to Part B or C or D,
you got to have that A.
So
you need to call Social Security or go by their office or create your account at ssa.gov. And then you have to apply for your Part B, as in boy, coverage.
That's a SSA, Social Security Administration. Right. It is a government website. We hope it's as intuitive as the Health Team Advantage website.
It's not, I can tell you.
Okay.
That's no slam against them. They've got so much information out there.
Part B.
That is all of your outpatient services. So your doctor visits, outpatient labs, surgeries, x-rays, testing, all of those. You need to apply for that 3 months before you turn 65.
And what happens if you don't?
Then you may not have it in place by the time you turn 65, and then you're really limited on your health care.
Okay. So again,
Very important.
90 days out is not too early.
No, it is not.
All
You
right.
will not be charged. So Part A doesn't have a premium.
All right.
You've paid for that through your payroll deduction to Medicare all of your working years. Part B does have a premium for most people.
All right.
Unless you're Medicaid eligible, you'll have a premium. You have to set up, how am I going to pay for this? You can have it deducted out of your Social Security check. You can have it deducted out of your bank account. You can choose to pay by paper check if you would like.
Then, after you take care of the B, there are some options that will come your way regarding the other half of Medicare.
That's right. So that just takes care of the hospital, your doctors, testing, labs. We still haven't talked about drug coverage because that's not built into original Medicare. So you have to have a separate drug plan. If you do not, then you will start incurring a penalty for when you do buy a drug plan.
Oh, wow.
Yes.
So if you don't address that or resolve it either way from the get-go,
Right.
it won't matter if you feel differently in 5 years. You still be paying that penalty every year. What happens if I wait till my birthday and I say, okay, today's the day, now I'm going to do it? Are you behind the 8 ball then?
Well, you're behind the 8 ball because you will not have the coverage you need.
Okay.
The government, CMS, will allow you to go 90 days past your birth month to get enrolled. So you got a 7-month window to do it.
Okay.
But you don't want to be any months without health coverage.
No, because anything can happen any day. Right?
That's right. Absolutely. So that's why we say, hey, 90 days ahead of time is not too early. You're not going to start paying that Part B premium until your eligibility month.
Now, what if I'm still working? Does that shove everything off?
Yes, so it can. If you are still working and you're covered under your employer's plan, and there are 20 or more people enrolled in that group plan, then you can delay your Medicare election without being penalized. So that delay can be for Part B and for Part D, the drug plan.
John, what about those of us on Medicaid?
Okay, so you may be on Medicaid before you turn 65. Medicaid eligibility criteria changes once you turn 65 and retire.
Okay.
So you want to be sure that Medicaid stays in place, but you can have both Medicaid and Medicare.
If somebody says, I can help with that, there's a small fee we need to take care of first. John, what should be our response?
Run as fast as you can. Do not worry about being rude. Hang up the phone. Don't say goodbye. Just hang up, and when they call back, don't answer.
Okay.
If they're wanting to charge you for their service, they're not in it for the right reason. They're not doing the right thing.
Another question. Will Medicare pay 100% of all my medical bills?
No, they will not.
And sometimes that's a big surprise.
It can be. So if you just have original Medicare A and B and even a separate Part D drug plan, you will be responsible for a large percentage of that medical bill.
Okay. Now, that kind of takes us back full circle. We talked about parts A and B, your hospitalization, and then, of course, your medical appointments, your traditional outpatient services. But let's get to, as we call it, the fun stuff, parts C and D.
That's right. So Part D would be your drug coverage. And that is always through an outside independent insurance company providing those benefits. Now, when we get into Part C, that is the part that comes in and reduces those out-of-pocket expenses under original Medicare. It would work typically how you're used to. You go to the doctor and you have a small copay rather than a deductible and then a large co-insurance. So you just have a small copay for pretty much any procedure you're going to have done. And then it also includes that drug coverage that we talked about.
Yeah.
And then it will include things like dental coverage. Dental is not covered by Medicare at all. As surprising as that is, vision also not covered by original Medicare. It's covered by your Part C Medicare Advantage plan. And then gym memberships, an allowance to buy over-the-counter items at the drugstore. It also includes benefits that can help you at home. So a big fear is, John, I'm being released from the hospital tomorrow, and I'm not ready to go home. So a lot of the Medicare Advantage plans will include care while you're at home after a hospital stay. They'll provide meals at home after a hospital stay.
Sometimes you need a little help along the way. And that really makes the transition stress-free and so much easier. I've taken notes, and then I want to go over it with my son or my daughter. If we need to call again and have the same conversation, that's completely fine.
Oh, absolutely. We welcome that. With a simple phone call, you can request your adult child to talk to us on your behalf.
Do my spouse and I have to have the same thing? We both love Health Team Advantage. We both want to be a part.
Right.
Do we have to have, there are multiple plans under the Health Team Advantage umbrella.
You do not. And we will put you on the plan that works best for your situation. We look at your medications. We look at your providers. We even have a plan for certain chronic health conditions. So you may need to be on one of those and your spouse be on a different plan.
Another affirmation for you. Can I be denied acceptance for Medicare?
No.
As long as you've got that 40, and that can be through you or a spouse.
Even though you didn't work, but your spouse did, you both still have coverage.
So there you go. So don't worry about it. John, I hear these things about HMO versus PPO.
That strictly deals with the network of doctors, hospitals that an insurance company has.
All right.
So if you're on an HMO plan, it means you have to see a doctor that is in network with that insurance company. If you're on a PPO plan, then there are benefits to go that will allow you to go to a doctor that's not in network. You may have a higher copay, but you still have the option to go.
All right. So just kind of the door may be open a little bit wider with a PPO, but it also depends on your specific medical circumstance and emergencies wherever you might be.
Wherever you are, you're covered just like you're in network. So you're traveling, have an accident, or a major health condition pops up and you find yourself in the ER. No need to worry. You're going to be treated just like you're at home and in your network.
There are some deadlines and some dates, and we need to pay attention to those.
Yes, we do. If you're just aging into Medicare, you're turning 65, you've got 3 months before your birth month, the month of your birth month, and 3 months after your birth month to enroll in Medicare and choose a Medicare Advantage plan. 7 months.
Okay.
Once you are in a plan and you're now past 65, what do I do in years to come in the future? So every October 15th to December the 7th, annual enrollment period, AEP, is the time of year where you can choose a new plan for the upcoming year.
Okay.
Right now, we are in open enrollment period.
And that means what?
January 1st through March 31st. If you're on a Medicare Advantage plan, you chose a new plan during annual enrollment period. And now all of a sudden, it's not working how I was told this plan would work. You've got a one-time shot to go in and change Medicare Advantage plans.
So maybe you didn't have any prescriptions.
And now you do all of a sudden.
Now all of a sudden you do, and that might impact your decision.
It very well
so you
could.
Get a second bite at the apple.
That's right.
And that's in play through the end of March.
That's right. Outside of that, there are special enrollment periods, whether you move to another service area. There 7 or 8 different circumstances that can create a special enrollment period. Moving is the biggest one. And a weather-related emergency can also generate a special enrollment period.
And then, John, there are also some special programs for those of us that may have unique medical situations.
There are certain circumstances where you don't have to be 65 to be eligible for Medicare. One of those is if you have been on Social Security disability for 24 months.
Okay.
You're automatically eligible for Medicare. If you have end-stage renal disease, you're eligible for Medicare. If you have ALS or Lou Gehrig's disease, you are automatically eligible for Medicare.
All right. So,
Any age.
and that can qualify you and that kind of regardless of dates,
Right.
times.